Hello everybody. If you're wondering how I went from this to this, let me explain. My name is Talia Smith, and in 2021, I took a fluoroquinolone antibiotic called Cipro for an uncomplicated urinary tract infection. Little did I know at the time that fluoroquinolone antibiotics had a series of black box warnings, one of which is that this class of antibiotics should not be used for uncomplicated UTIs and should be used as last resort only when no other options are available due to their permanent and disabling side effects of the muscles, tendons, joints, nerves, and central nervous system. After my third dose of ciprofloxacin, I was in the emergency room, unable to walk. My decline was so rapid that within 5 months, I had lost over 50% of my body weight and entered into hospice. I spent 9 months on hospice and transferred to palliative care, which I am still currently on. I cannot do anything for myself and need 24/7 care for my survival. So the point in me telling you this story is this. We often think that antibiotics are needed for everything, and they're going to fix any issue that we have. But that's not true. Fluoroquinolone antibiotics in the form of pill, IV, injectable, eye drops, and ear drops all cause fluoroquinolone toxicity, or fluoroquinolone-associated disability, FQAD. Regardless how you feel about this class of antibiotics, or if you've taken it before, or if you prescribe it all the time, the fact of the matter is this. This class of antibiotics has so many black box warnings for a reason. And while people will respond and say, no drug is safe, and you can experience adverse effects from any medication, which is true, this class of medications is completely different. And that's because the severity of these adverse reactions are known and are documented. It's just that prescribers are not always following the guidelines, and patients don't know what the guidelines are. If anybody tells you this is rare or you think this is rare, just watch the comments that will come out on this video to know that it's not as rare as people think. And even if it was, that doesn't mean that you're exempt. It doesn't mean because something is rare, it can't happen to you. It can happen to anybody. It happened to me. So please don't take antibiotics unless you absolutely need them. If your practitioner is prescribing you a fluoroquinolone antibiotic, not as last resort, ask for an alternative if there is one. If there isn't, well, then you have to take it. But there are certain measures you can take to try to prevent from experiencing fluoroquinolone toxicity, also known as being floxed. Please share this video far and wide so people understand the dangerous nature of this class of antibiotics, and then they are able to make an informed healthcare decision for themselves. That's all I got. Thanks, everybody.